Barcamp. I'm going to get started. I'm totally switching gears to the applications of technology to medicine. So a little bit of a shift, so I hope you'll bear with me. The title of my talk, my name is Benjamin Kalayjian. The title of my talk is Democratizing Health. So it's the virtual gaze and a vision for health empowerment in the age of digital disruption. So I want to bridge the gap between medicine and technology, particularly healthcare and technology. So the objectives, basically I'm going to divide this talk. I'm going to speak kind of fast because there's a lot of things that I want to cover. 3 broad objectives. First, I'm going to paint a big overview of the applications of technology in medicine, particularly clinical care and healthcare epidemiology. Thinking a little bit on the economics, the consumer side of health and medicine technology, the investments, also some of the limitations of the technologies that we're using, the big applications. Then I want to switch gears, and I want to speak from the perspective of a physician. I'm a medical doctor. I want to present a little bit of a medical perspective on how we make decisions in the clinic and how technology and the use of data management can help us make better decisions, and also look a little bit from a population public health perspective, also thinking about data and how this can help us make good decisions. And then finally, I want to end with a bit of a philosophical discussion about the shifting power dynamics that are happening within health. As we understand health, as we understand our bodies, particularly thinking, I'm going to root this in kind of the discussion of Michel Foucault, who wrote a very famous book, a critique of medicine, and how this is being disrupted in many ways now with the access immediately to our smartphones, our devices, our smartwatches, how this is changing how we understand our bodies, our health, and what this looks like for the future. So just a bit of background on myself. I'm not a data scientist, but I've been growing up in the era of Facebook and all the other new technology. So I'm very familiar with technology, but I'm not coming from a data analysis background, so to speak. But I'm a medical doctor. I'm a doctor of internal medicine. I trained at Tulane University in New Orleans, Louisiana. That's where I'm coming from. I work now as a primary care physician, so kind of on the front lines of healthcare. I work at a small community health center in New Orleans called Crescent Care. And I also have training. I recently completed a master's program at Johns Hopkins School of Public Health in community-based primary care programs in global health. So really thinking about the intersection of culture and community and how that informs the strategies that we use to empower communities through health. So that's a little bit of my background. So I want to give you a little bit of my ideological kind of frame of reference, just so kind of to inform a little bit of why I'm here and what I'm talking about. Just a little bit about myself. My father is a physician. He trained in infectious diseases. And my grandfather was also a data scientist. He was involved in the early development of radar. And so my connection with Armenia really has a lot to do with technology, as I'm a diasporan Armenian, and this is my first time back in Armenia. So the connection with technology has always been kind of a lineage, and it's very important for me to kind of bridge this gap. From a more kind of philosophical or idealistic perspective in healthcare, I'm really founded primarily in a declaration, a World Health Organization conference, which was held in Almaty, Kazakhstan in 1978. This was the Alma-Ata Conference on Primary Care. They created a declaration, the Alma-Ata Declaration, this is in 1978, which defined for the world kind of a vision for health. Health is a human right. So they defined it, and I'll quote, "Health is the complete physical, mental, and social well-being of an individual." And really defining this as a fundamental human right. This is really an organizing document for many of the big public health interventions around the world, UNICEF, World Health Organization, etc. They really commented in an important way on existing gross socioeconomic inequalities and how this informs health, really the complexities of it. And they introduced for the world the role of primary health care as it really means to empower people through health. So that's kind of the lens through which I'm looking. And finally, I want to just bring in just a touch of Gurdjieff, George Gurdjieff, who is originally from Gyumri and is a philosopher or a mystic who really informs my medical practice. But I'm just going to quote from him and you'll understand kind of why this is relevant. But so this is a quote. "Just as a physician who does not have access to the soul of his patient cannot be of any real help to him, so also cannot be a good priest without being at the same time a physician, because the body and the soul are interconnected." So this is kind of an idea that I think about a lot in my medical practice, really incorporating emotions and mental health in clinical care. This is important really because we're thinking about the limitations of technology. So we're going to get a lot into technology and really seeing where that frontier exists. So let's get started. we're in the midst of a technological revolution right now. Technology, as you all know, is reshaping the world very rapidly. In many different sectors, communication, transportation, a lot of the ways that we understand the world is shifting under our feet. This has been termed the digital disruption. So a disruption in the way goods and services are exchanged. But healthcare is really slow. Healthcare has been very slow to adopt a lot of the tools of technology. We're using a lot of them, but not fully, at least the way I see it. At least the way I see it in other industries. So pharmaceutical development, I'm sure we've heard lots of lectures on pharmaceutical development and whatnot. But healthcare is really lagging behind. This is from a recent publication in The Economist. This was published just last month called The Quantified Self. So this image really speaks volumes, kind of the whole perspective. So this is just an overview, kind of all the different ways that digital technologies can really change the way we understand our bodies. So artificial intelligence, I know many people are talking about that here, how we can train computers to pick up patterns, whether it's images or just complex data sets. The idea of the Internet of Things, so I like to throw in that category biosensors and the ways that we're digitizing human signals, basically making them electric and understanding them in a little bit more different, nuanced way. We always talk about one big thing is mobile health or apps in our smartphones, our mobile devices, which give us lots of information about people, can really shape behavior, but also putting healthcare, access to health information in our pockets. And then, things like thinking about accessibility, particularly with the COVID pandemic, we switched a lot to telemedicine. We're reaching people through the phones. So people are a lot more empowered. They don't have to go to a doctor's office, go to a clinic. Really, technologies are breaking down the barriers in terms of access. And in population health, in the public health space, digital technologies can really revolutionize the way we understand populations of people. In many ways, we think, we go into villages, we collect data, write things down. But with digital technologies, we can aggregate so much more information. So it's a very exciting time for healthcare. So let's dig in a little bit on artificial intelligence. So I know there's, like I said, lots of talks talking about drug development, the way we can kind of use computers, machine learning to recognize patterns. What I'm really interested in a lot as a clinician is the idea of disease diagnosis and really thinking about how we can predict a person's risk, essentially providing risk stratification to people. Both of these charts are from some big reviews of artificial intelligence, recently published in 2018 in Nature Biomedical Engineering. And then basically some critiques of artificial intelligence really identify that there are limits to how much artificial intelligence can improve clinical care. And one of those big things is in the emotional component. I guess that's why I included Gurdjieff. When we think a lot about the emotional component of health, that's really important. And there's a lot of dynamics that really a human being at this point has to kind of recognize in order to really deliver the best care for our patients. So it's kind of a frontier, the way I think about it in terms of health technology. From within healthcare, as I've kind of alluded to, there's so many different ways that we're using digital devices. I mean, when I write my notes, I read it all into my smartphone. We, order our clinics all with computers. We're calling people, with telemedicine. So there's so many different ways that we're using it, but we're not always collecting all of the information and organizing it in a really, a really systematic way. So I think that's I guess, a take-home point that I'm trying to lead to. So let's talk a little bit about money, because I think that's really a really important driver. This is all from this Economist Technology Quarterly. So just these three important graphs here. So this is looking at the first graph here on your left, on my right, is looking at the dissemination of smartwatches. So as you can see down here, in 2015, this is when Apple launched their smartwatch, the Apple Watch, the iWatch. At that time, there was $8 billion of global sales of smartwatches. Just 6 years later, in 2021, the global sales was $29 billion of smartwatches. So as you can see, in many parts of the world, the dissemination of these technologies is rapidly rising. In this middle graph, now this is a little bit, perhaps you have to kind of use your imagination. This is just looking at the United States over the last 120 years. This is looking at technology adaptation, so the ways that people are using new technologies. As you can see at the end with these the orange lines and the red lines. We're looking at smart mobile devices, smartphones. As you can see, it's almost vertical the way these technologies are disseminating into populations. So many people are collecting information on their smartphones, on their watches, but we're not really systematically organizing it and using it in clinical care. And then this final graph, I think is very interesting. This is looking at the attrition rate, or thinking about the longevity of apps developed for mobile health applications. So in this light blue line, it charts basically the number of new applications that are created for health, like for health purposes. And then in the dark blue, we see how long they're actually remaining on the market. So I've been in healthcare through training and my residency for the last 10 or 12 years, seeing a lot of different technologies, a lot of different new apps come on the market. Oftentimes, they're around for a couple of years, and then they fall off. So for me, this is thinking, getting my mind thinking about what are the good ideas, and how do we separate good ideas from, ideas. Everybody's really interested in it, but how do we know what's objectively good, or what's a really worthy investment? So this is, these charts are from a big startup or kind of incubator in the United States called Rock Health. So they're a real leader in digital health investment. As you can see, this first chart on the top is looking at investments per year. So this is in digital health startups. So as you can see, in 2021, the amount of investment is unprecedented. So there's so much money, so much interest going into digital technologies. You can see in this lower graph, this kind of breaks down into some of the different areas, the different sectors. Some of the leading sectors include mental health, research and development, on-demand healthcare, fitness, and the treatment of diseases. I'll share all these slides so you can get the specific numbers. But we're throwing money. There's a lot of interest. But the question is this going to the right places? Are we moving the needle on health appropriately? I think that's kind of the leading question. So I want to switch gears. This is kind of the second part. I want to give you a little bit of my perspective as a clinician, how I make decisions and how we can use data, all this data that's being aggregated, how we can use this in our, to really optimize health of individuals. I was really inspired by this book, The Signal and the Noise. This is written by a data scientist by the name of Nate Silver. He does a lot in election predictions. He's a big numbers guy, and he really talks a lot about kind of the art of separating a signal from the noise. So when we think about quantitative and qualitative data, how do we make sense of it all? Because that's essentially what we have to do, with technology. So in the medical clinic, what we have to do, what I do as a clinician, I look very clearly, very, very carefully at quantitative information, measurable information, vital signs, labs, physical, things that I can, say with certainty exist. But the qualitative component, or what we say in medicine, the subjective component, what a person feels, what they really care about, what their values are, is also very, very important. And so integrating the two into our medical decisions as we come up with a plan, what are we going to do, what are we going to treat, where are we going to go with our actions, is really, really important. In medicine, what we call this is kind of intuition or gestalt. So that's why in the United States it takes about 12 years or so to train as a physician. You really have to learn from practice, recognizing patterns, recognizing a sick person from just maybe a very nervous person. So really thinking in kind of objective terms about things that are very subjective or very, very difficult sometimes to ascertain. But in medicine, when people come to see a clinician, really what they're looking for is a prognosis. So essentially what we're doing is we're trying to figure out a forecast. We want to know whether you come to see me, you have chest pain. I have to aggregate all of your information, your age, your medical history and whatnot, and make a prediction as to whether it's safe for you to go home or whether we need to watch you in the hospital or admit you to the intensive care unit. So it's really, it really makes a lot, they're very big decisions. And they don't really rest, they rest more on a clinician's experience than on hard data. And I think that's kind of where we can be moving with technologies as we really accumulate and learn from patterns if we're collecting it correctly. And this is just an old kind of something that you're taught in medical school, that 80% of disease diagnoses are made from history alone. So again, when we're thinking about data, thinking about information, the ways we can collect it is rapidly changing through our smart devices, through our wristwatches and everything like that. This can provide so much more information for us to make really very precise decisions about what to do for people's health. So I want to talk just very briefly about global trends in healthcare. This is a lot of information coming from the World Health Organization. We are currently living in what has been termed an epidemiologic transition. Really over the last 50 years, in many ways over the last 100 years, we are moving globally in a shift from infectious diseases being the largest causes of morbidity and mortality to more non-communicable diseases. So things like heart disease or diabetes, obesity, even mental health might be considered in this category. But we really have to think a lot about chronic disease management. So these are people who are living longer, but they're more complex and they have a lot more conditions. It's very expensive. And so the economic burden is really quite important as we're thinking about the future of healthcare. And we have to really be orienting ourselves towards prevention as opposed to just disease-oriented treatment. So non-communicable diseases, just a little bit more. This is my bread and butter. This is what I see all the time in the clinic. Cardiovascular disease, lung disease, all different types of internal conditions. This increases susceptibility to infectious diseases, particularly like COVID-19. So it has a lot of relevance even in the midst of intermittent pandemics. This is influenced in many ways by changes in the way we live, urbanization, changes in our diet, changes in, increasing sedentary lifestyles. So there's a lot of shifts. It's affecting almost all countries in the world. But to focus a little bit on Armenia, this is from a World Health Organization report in 2019. So the economic impact, not just to Armenia, but in many countries is quite significant, in fact, to the tune, this is in 2017 dollars, but 362 billion dram. That's in 1 year, expenditures from both direct and indirect costs in non-communicable diseases. So thinking about prevention, thinking about how we can empower people through health, doesn't just have an economic impact when we're thinking about actually dispensing medications or hospitalizations and whatnot, but really thinking about making or ensuring that populations are healthy so that people can work, people can sustain themselves longer. So I think of technology as a really important empowering tool to give people a lot more access to health knowledge. So finally, this is the kind of the third part. I want to switch and kind of discuss a little bit philosophically what I see happening with these major shifts that are happening with technology. So this book, The Birth of the Clinic, this was written by very famous French philosopher Michel Foucault. This was published in 1973. This was a very important epistemology or a history of knowledge. He was a very important critic of the biomedical system. Basically, he critiqued the way that when you go to see a doctor will fit your story of illness through a biomedical model. So I'm taking your story and I'm fitting it through what I understand. And that has some problems, realistically. Everybody has their own story and their own information. And it really put that in the hands and the power of the clinicians. He was quite a critique of the medical system. What we're seeing now, and what a lot of people are talking about, is the rise of what's been termed the virtual gaze. So Michel Foucault called it the medical gaze. That's the gaze of a physician on a patient. We're talking about now the virtual gaze, where people can access health information, unprecedented amounts of information on their smartphones, on their computers. Everything's digitized. All books are accessible. Also with this self-service, direct-to-consumer, access to healthcare, we have so much power in our hands. I can't tell you how many times people will come to me and they say, oh, well, I Googled my symptoms, or I looked up, these are the diagnoses that I think we should look at, or these are the drugs we should look at. And I often wonder whether the information that people are getting is as clearly organized, or this is just enhancing anxiety. People are very nervous about all the possibilities because these are big words that people don't fully understand, and it might be totally irrelevant to them. So really thinking through the ways that technology can both empower people with information, but also, kind of offset, I think, the anxiety that this vast access to information has unleashed on the world. And so that's pretty much, I have only 5 minutes here. So just in closing, I just want to, get ideas started, and I'm happy to answer any questions. Thinking about what does the future of healthcare look like? I'm very interested in collecting a lot of data and being informed by the epidemiologic burdens that we're all dealing with around the world. Can we use remote monitoring or sensors on our wrists or our mobile devices to collect people's information? Can we accumulate information that will help us with better forecasting, like we've done with weather prediction? If we can really understand with a little bit more precision the dynamics of diseases, we can really, allow, a bit more precise risk stratification for individuals. So that's pretty much it. I'm happy to answer any questions. This is my contact information. Thank you very much. Yes.
Thanks, Ben. What is your opinion on the role that insurance companies play when health insurance companies, especially in America, if you have all this data that you're sharing with your doctor, do you see privacy issues?
I mean, certainly. I think it's really, I mean, for sure it's really important. I attended a talk recently where we're talking about, there's so much information that's being collected, but we're just not using it, and we're not really fitting it into the framework of healthcare. So right now it exists on your smartphone between you and your device in many ways. You know, thinking through the privacy issues, this is huge. You know, everything obviously needs to be super encrypted. Certainly if you're going to share your information in some organized way with a clinician. I mean, we have a lot of rigid standards in healthcare talking about telemedicine, the way, you know, we have to communicate over very secure platforms. So it's always, you know, we think through that in health, and I think it will have to be thought through. But it's kind of, you know, we're kind of in this weird territory where people are collecting information, but we're not using it, you know. And so applying some of the same kind of rigid, you know, the way techniques that we organize privacy in healthcare already, I think would have to be applied to the digital space.
Hi Ben. What do you think would be the pushback from the healthcare community when it comes to like integrating these wearable technologies and all this data being collected into healthcare? And like if there's already like pushback from the healthcare community, what do you think like the main concern would be in integrating those two?
Well, I mean, I think it's a complex question. I mean, I know some of the major players in healthcare, even in the United States, are trying to sell these devices. You know, they're incorporating the digital space, so they know that this is a huge consumer demand. Frankly, I just don't think that, I mean, at least the way healthcare is administered in the United States, the pharmaceutical industry in the entire world, it's massive. And I don't know if it's very expensive to maintain all the complexity of healthcare that we're doing. So I think it will just, I mean, I don't know if we really have to, I mean, I don't know. I mean, there's going to be pushback, but unfortunately in healthcare, we're really focused on management of diseases, not really curing people. So there will be kind of philosophical, I think, pushback, you know, just because sick people do make some people a lot of money. I mean, just in real talk. But that being said, you know, I think we can't really argue with the fact that so many people are using smartwatches and digital devices, and they're collecting their data. And so I guess the way I'm thinking about it as a clinician is, let's just use it and help people live healthier, and then figure out how to, you know, to make things work economically with insurance companies. I mean, I think ultimately healthy people are an economic benefit for any country or any organization. You know, we're talking about insurance providers. You know, you want your people that are insured in a plan to be healthier. So, so I think the money may work out if we just kind of, if you just think through technologies and really build out systems that make people, that help people live healthier, I think. So, who knows? Yes.
Benjamin, thank you for your presentation. My name is Nadine. I'm working in healthcare communications, and I have a question. Which ways do you see to empower patients and doctors in current paradigm where patients are evaluated as a cash machine or doctors evaluated as a service providers like barista and so on? I see that should be done different ways to empower patients and doctors. What is your view? How to empower patients and doctors?
Well, I mean, it's complicated, I think. I mean, I think from the doctor perspective, I guess I'll start there. It is complicated because I will say that one of the reasons why technology hasn't been fully integrated into, you know, healthcare delivery is that doctors are quite slow in terms of their adaptation. They like the things that they know. So I think ultimately a clinician's intentions are for their patients to do better. And I think if we're able to start demonstrating the value of these technologies, you know, wearable devices, it's starting to show through in like diabetes management. When we're talking about people who monitor their steps, there's a little bit of data coming that people lose weight, that their hemoglobin A1C, which is a measurement of diabetes control, is a little bit improved. So I think there is an incentive to kind of begin to convince the medical community that these technologies might be beneficial, you know, to kind of implement larger. And I think with people, with individuals using smartwatches or whatever, you will feel the impact, you know, just by taking power back in your own, you know, health. So I think I kind of believe that these challenges will work themselves out, just in a sense, because I firmly believe. I mean, I do it myself. I monitor my own, you know, exercise. I really believe that it works, and you think better and you feel healthier. And I think ultimately that's the test of the viability of any sort of disruptive change. I think that's it. Sorry. I'll be happy to answer any questions if anyone wants to come to the back. Thank you very much.